Does she have blue hair?
Is she even a doctor?
Do you think she's high right now?
That's a secret I'll never tell. XOXO, the Wee Doctor. Joining. If you guys don't know who I am or why I am here on your screen talking to you, my name is Dr. Jaya McSharma. Oh, am I supposed to be using these AirPods? But my name is Dr. Jaya McSharma. I am the Wee Doctor, TheOuidoctor.com. It means a couple of things. It means just say yes to yourself, as the French word for yes is oui, 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 madame, monsieur, mademoiselle. It also means I believe in plants before pills, because when you want to treat your pain, anxiety, insomnia naturally, you call the Wee Doctor. Get it? You say it real fast. See? That's a double entendre. I'm very French today.
I guess we were supposed to click it.
Oh, guest is in green room. Oh my God, how fancy. I'm using this software called Ecamm Live. Thanks to my friend Joel Sharpton for telling me about that. Kylie is frozen. Kylie, why don't you introduce yourself to your adoring fans?
My name is Kylie Vidrine. I am a pharmacist and owner of Rose Nutrients Run Lake. We specialize in BHRT, which is bioidentical therapy. And I've been doing this for about 5 years now. Doing it probably 4 years. So yeah, here we are.
Here we are, and you are a PharmD. Did you say that?
I didn't. I am a PharmD. I have a doctorate in pharmaceuticals. So I know about the pharmaceuticals.
I'm gonna toot your horn since you won't do it. I've gotten very good at tooting my own horn, so you don't have to worry about that. But this is Dr. J MD and Dr. K PharmD, and we are on the case. We're hormone busters. We need our own Ghostbusters like Station Wagon, except we're hormone busters. Or Mythbusters, or I don't know. I'm very excited, and this is definitely just water. Cheers, everybody. Cheers. What's going on? Well, if you only have a little time, let's just start talking. Number one question I hear is, they want to know about this cream that you can apply to this area for people with PCOS and hormonal imbalances that will take care of that. And how they get it. So can you tell us about, because I know you compounded that cream in your pharmacy, and can you just tell us about what it treats and how someone can go about getting it, which basically, if I'm your doctor, I'll order it, or you can have your doctor order it from Kylie. So if you could just tell them what it is and talk them through the process of how their doctor would order it, if for some reason their doctor is not me.
We have a cream that has metformin, azelaic acid, and progesterone, and you apply it, and spironolactone, I'm sorry. And you apply it directly to the areas that you have hair, usually right here with people with PCOS.
Right.
And it helps decrease the androgens circulating in the bloodstream so that you don't have the hair growth there.
Right.
And it helps get rid of the hair growth.
And then how often do they apply it?
Twice a day.
And you said it's around $60.
For like a 1 to 2 month supply.
Which is great. I mean, that's more than I spend on a lipstick in Las Vegas. Or that's less than I spend on a lipstick in Las Vegas. I don't even like that much. It's less than that. But shout out to Ariel at the Lip Lab. She was still sweet.
Okay, so just to recap what we said, Dr. Jaya is an MD, she's amazing. Dr. Kylie is a PharmD, she's amazing. The two of us together will heal the world, at least in Louisiana and Texas. And so just to review what we just said, there is a cream for hair growth that you can apply, like right to where you have the extra hair, which is called hirsutism, HIRSUTISM. Hey, Jesse! Oh, okay, he could at least look a little excited.
That's my husband.
So rude. So you apply the cream directly to where you have the excess hair. You apply it twice daily, and then the hair goes away. And for about a 1 to 2 month supply, it's only $60. If you're my patient, you would just book an appointment for me to do a wellness evaluation, and then I can order it from Kylie. If you are not my patient, you can have your doctor send in a prescription by calling Boudreaux's new drugstore and say, I want the hair face cream, which has metformin in it, azelaic acid, spironolactone, and something else you mentioned.
Progesterone.
Progesterone. So that's it. That's life-changing right there. I feel like if women with PCOS or some kind of hormonal imbalance can start treating it topically, then you give me a chance to balance your hormones. So theoretically, Kylie, I would think that they wouldn't need the cream once their hormones are adequately balanced, but they would have it if they need it. Is that right?
Correct. Yes.
Okay. Jennifer Johnson says, I had a complete hysterectomy in January of 2006, and I have done no hormone therapy.
Oh, no.
Oh, mama, call me tomorrow. But that's actually a very common story, I feel like. My mom had a hysterectomy due to excess bleeding, and she was put on Premarin, which we now learned Premarin is an oral estrogen, and that is very pro-inflammatory. The method of how you take your estrogen is very important. Nobody who still has a menstrual cycle should be on estrogen. Very few cases, I think, would be the exception for that. But pretty much if you're still having your menstrual cycle, you do not take estrogen. But it is still important to balance the remaining big three hormones, progesterone, cortisol, and testosterone. So even if you're still having menstrual cycles, there are things that we can do to help you that are blowing my mind. For example, estrogen has over 400 functions in the body, including in your gut, in your heart, in your brain. So all these women that are turning 50 and 60 getting diagnosed with high cholesterol, getting diagnosed with heart disease, getting diagnosed with osteopenia, breaking their hip, what if right when they stopped having their cycle, we balanced their hormones and those things didn't happen? I'm talking a lot because I feel like you have work to do, but if you also want to speak.
Crazy talk.
Because I know that you didn't know that this was going to be like an hour. Anything to add there?
No, it's just pretty mind-blowing how much estrogen does. I think everybody thinks, oh, night sweats, I need estrogen. Oh, my vagina's dry, I need estrogen. But it does everything else. Like, women get older and they're like forgetful and they think, oh, I have dementia, or oh, I'm just forgetful. No, it's your estrogen.
It's your estrogen. What did they used to say on House? They always say, it's lupus. We're going to get t-shirts that say, it's your estrogen. One thing that I think
it's your estrogen. Yes.
Estrogen. One thing that I thought was really amazing with my new girl crush, Dr. Pamela Warshin Smith. Warshin is spelled like Martian, so I want to ask her about that one day. But she is turning 70 years old. She had this incredibly intense reconstructive surgery for a tendon in her leg or her foot. And basically her orthopedist was like, be prepared, 6 to 9 months recovery. It's going to be hard to walk. You're going to have a huge scar. She went to follow up with him at 3 months. This is a true story from an MD. And she said she was almost completely healed and there was no scar. And he's like, what the heck? You're 70. How are you healing like this? And she's like, estrogen. So basically because of estrogen, she had better wound healing, better joint mobility. Estrogen controls the pain receptors in your spine. Get with me, people. You see what I'm saying? You're in pain. You're anxious. You can't sleep. You have night sweats. You're gaining weight. Your brain is foggy. And you think, oh, this is just part of getting older. No, ma'am. Traditional medicine has failed you. No. And we are here to make it right. Okay.
Yeah, but you forgot a very important part of the story, too.
I think
She had a big... What?
I think I forgot the LDN, but go ahead.
No, just like the scar. She had surgery and he was like, this scar looks amazing. And she's like, yeah, I got with my compounding pharmacist BFF and she made a scar gel for me and now my scar's gone. And he was like, what is that cream?
Yes.
Yeah, so another thing we make at Boudreaux's is fantastic scar gels for C-section scars, orthopedic surgery scars, all kinds of scars, acne scars, anything. Amazing. We make fantastic creams for that, yeah.
This is so exciting to me. I never envisioned having like a pharmacist, PharmD bestie, and the fact that you're a compounding pharmacist, and you're literally like taking us back to the 1950s where your pharmacist at the corner drugstore is the same person who made your medicine. It's like re-establishing trust and connection in healthcare. I think it's amazing. So
right.
if you don't take home anything else from tonight, y'all, don't accept what has been laid out before you. If the doctor says you're just getting older, well, this is just part of getting older. You're going to have a huge scar. You're going to take 9 months to heal. Don't accept that, because maybe your likely male physician doesn't know what we know. And I don't want to knock on other doctors. I mean, male doctors, come on. Sometimes they just don't listen, but that's men. But it took me leaving 12 years as a hospitalist in traditional medicine. It took me leaving corporate medicine to even have the bandwidth and time to learn about this stuff. So I do not fault my colleagues who are primary care doctors, urologists, OBGYNs. They are fighting the good fight every day, and I take my hat off to them. They just don't have access to this information because healthcare is killing the providers because our medical system is completely broken. So, yeah. So Kylie and I are like the Mavericks, I guess, which I don't want to use that analogy. Never mind. Okay, next question. Oh, Leslie Whitaker says, hey, girl, hey. Hey, girl, hey. Katie Kimball Jackson, would an ablation make a difference in the need for estrogen since I no longer have a menstrual cycle? I guess she means an endometrial ablation. What I'm assuming. I don't think that would make a difference unless it affected, I guess that could be like putting her into a surgical menopause. But I think the main thing is, if you are not having cycles, if you have not had a cycle in 8 to 12 months, then you probably need estrogen, and we need to test your saliva right away. And that's the other thing I wanted to talk about today, saliva testing versus blood testing. Blood testing is what is done most often, but it is not the most accurate. And that is because the best way to replace your hormones is transdermally. When you take estrogen orally, it's pro-inflammatory. When you apply it transdermally, it's anti-inflammatory. Inflammation is the reason for every single disease process. So every time we put something into our mouth, giggity, or make a decision, we want to always go towards the anti-inflammatory cascade. Okay? So that's really important. So when you put estrogen or progesterone cream on, it's sucked in by your cells within 12 minutes. So if you're testing a serum level, which is the blood, you ain't getting an accurate result. So number one, saliva test, not blood test. Number two, friends don't let friends put pellets in their butt.
That's right.
No to pellets. I feel like you were going to say something there and I cut you off.
No, it's okay. Go on. Go on.
You know, I'm just like getting on my soapbox and preaching. Just say no to pellets. And one thing is, I had a patient tell me today she did used to do pellet therapy and it ruined her skin. And guess what? Because it had too much testosterone in it. And guess what else? She just had to deal with it because once the pellet's in your butt, it's there for 90 days and you cannot adjust the dosage. So I do think there are providers out there who are doing pellets in good faith, and I also think there are people out there making a bunch of money off of pellets, and there's no science behind it. None. No good science behind it, so just say no to pellets. Brittany Dirks-Trahan, does it matter where we apply the meds transdermally? Is there a better place than others? I'm going to defer to you on this one because you're definitely the expert.
So the best place to put it, it kind of depends on your lifestyle. So if you have grandchildren or kids and you apply it right here on that soft skin between your elbow and your wrist, as long as you don't touch your children's skin or your loved one's skin for at least 2 hours, that's a perfect spot to put it. And the best thing to do is put it in a small area because you have more absorption. So instead of rubbing it over the whole area, if you just pick like a small, like your wrist right here, it goes right into circulation right here. Another good place would be to
a 2x2. Like it doesn't have to be a big area at all. Yeah, like that big.
Right.
Okay.
Yes. Also, another good area would be behind your kneecap because that soft skin goes right into circulation also. Oh, look at the puppy dogs.
No, that's Imzadi.
That's a good spot to put it. If you are going to touch a loved one, unless you do freaky stuff in the morning with your husband behind your knees. I don't know. Everybody's different, you know.
I'm too tired for that. I'm sorry. I just can't. I love him.
You need estrogen.
I need estrogen. I need something. Yeah. So, and then can't you do inner thigh? Do some people do inner thigh for the cream?
Yes, you can do inner thigh. That's a good spot too. Mm-hmm.
But the smaller the area, the better. And then you just don't, for 2 hours, you don't want to go rub whatever you just applied on your pet, your son, your husband, you know, because you have had patients where they transferred it to their spouse and then all of a sudden had a husband with too much estrogen or something like that, right? You don't want that.
I had a cop come in actually, and he was like wanting to get his hormones tested and his progesterone was like off the charts. And I was like, does your wife use transdermal progesterone? And he was like, yes, she does. I was like, tell her she's putting it all over you.
So you know that they were a very loving couple.
Yes. So that's awesome. Yes.
Well,
because the progesterone made her in a good mood, made her lovey, made her happy. So, you know, she hugged up on her man.
Yeah, which is good. That's what we want. Erin Posey, this is a good question. I want to answer it again. She says, I'm still not clear on why saliva is more accurate. So one of the things that I learned is that your serum test, your blood test, is very dependent on, obviously, the amount of estrogen in your body. Estrogen is excreted through your doo-doo. So if you're constipated one day, your estrogen level is going to be a different level than versus a week from then when you have a good bowel movement. That's one thing. I feel like the blood spots can be very inaccurate. But also the reason why the saliva is the gold standard of what we're talking about is because when you replace hormones through the skin, the blood cannot catch it in time to give you an accurate level. And you always want to treat hormones through the skin because that's the only way to take it where it's anti-inflammatory, does not promote things that you're worried about, heart, stroke, cancers, right? So when you're taking your creams transdermally, the only way to get an accurate level is through the saliva. And yes, Kelly, I did say doo-doo. I'm sorry. Okay, Tara Seeley, is the cream just for progesterone? How does one get the other hormones? So yeah, can we talk about all the ways that you apply estrogen, progesterone, and testosterone? I know you do injections, patches, and creams, right?
Yep. So the best thing to do when you're first starting hormone therapy is to do all the creams separately so we can adjust your dose correctly and know what's needing adjusting. But we can, once we get you stabilized and happy and feeling great, we can put all the hormones into one cream. So we can put estrogen, testosterone, and progesterone into one cream so you don't have to apply 3 different creams every day, which is pretty awesome. And it's very cost effective to do it that way.
Okay. Yes, somebody was asking the average cost, which I think is also a good question. I know I get the progesterone cream at somewhere around $60, but I don't know if you are able to answer that question just on average what a woman might spend or a man might spend on hormone replacement through your pharmacy.
It's around $60 for the cream that lasts a month. However, like I said, once we get you stabilized and you get 90-day supplies at a time, 90 days is much more cost effective because we only have to make it once and it lasts 3 months. And I know like during these times, like times are hard, but it really is life changing. I mean, the stories that I have about hormones changing people's lives it's pretty priceless. I mean, I know 60 is kind of a lot, but not to feel good and feel your best, you know?
Yeah, and I know everybody's budget is different, but when you look at the things that you might spend money on, you know, movies, coffee, face creams, mascara, clothes, and you compare it to, okay, maybe if I have to cut back on those things, but I'm going to reduce the risk of disease for the rest of my life. You know, when you look at it that way, it's like a no-brainer. And, you know, we can always do what we can do to work with you guys. But from what I'm hearing, it's maybe $60 to $100 a month at the beginning because you may be getting your formulations separately. But once we know what dose you need, and once we know you're rocking and rolling and like feeling amazing, then you can get a larger supply at a time, and that will help you with the cost. And that's the thing is, like, Kylie and her husband Jesse own the pharmacy. They're parents, you know, they have kids at home. They understand that life be lifing sometimes, and that's the other thing about developing a relationship with your pharmacist. You can be like, Kylie, shit, Jacob just got fired. I don't know what to do. Can you tell me, what do I have to have this month? I have $60. I need these 3 things. What do I have to have this month? She will do that for you because she understands that you're human, because she is also human. And things happen.
I'm a real person.
She's a real person.
Yes.
Tara said that's not too bad. The pellet is like $3.75. Yeah, girl. When that pellet's out, when that pellet's done, you come see me. And the other thing that Dr. Pamela was saying about pellets is, she said, number one, I would never do pellet therapy because I can get the hormones in you in another way, in another method. And she said, number two, I would never do pellet therapy because you're going to feel pretty hot in 6 months, and you're going to want to show off your booty, and you're going to have a big scar from pellet therapy. So what's the point of that? Friends don't let friends put pellets in their butt.
Right.
They just don't. Let me see. Tara Seeley, are you located in the Shreveport-Bossier area? Tara, I, as the we doctor, am located in Minden in Shreveport. And Kylie is located at Boudreaux's new drugstore in Lake Charles. But we do telehealth, and she ships directly to your home. So you don't have to go to Lake Charles. You pay her over the phone, and she ships it directly to your front door. So, oh, she said, I love this real talk, down to earth and relatable. Thank you. We appreciate that. Let me see if I got any other. Okay, I actually might have to look this one up because I don't know, but I'll ask in case you knew. Huh?
I was going to say, tell him the story about how she was sitting next to the guy on the airplane and he had pellets and it got infected in his butt. And
Oh
he
my
couldn't sit on his
God!
butt.
I forgot the biggest reason that she doesn't use pellets. Oh, okay. The biggest reason that she doesn't use pellets is, she said, globally, not even in the United States, globally, including the United States, 99% of pellets are not completely sterile because you have to pay extra to irradiate the pellets. So you are getting something that's not completely sterile put into your butt, high risk of introducing bad bacteria and an abscess. And she was talking to this man next to her on the plane, and he kept leaning over, and she's like, sir, do I need to scoot over? What's happening? He's like, I'm sorry, I just have this huge abscess on my hip from getting pellets. And she was like, boom, roasted. That's gross, y'all. Don't put dirty pellets in your butt. Stop it. Stop it. How can providers get info about using your pharmacy and compounding services? Yes, we want all the doctors in the world to use Kylie. So Kylie, they can either go to your website, or how would you like a doctor or provider to reach out to you to establish a relationship?
They can either go to our website and go to the link about asking a question. It goes directly to my email, or they could call the store at 337-436-7216 and ask to speak to the compounding pharmacist. And I'd be happy to give them all the information over the phone or by email. We have leaflets I can email them with dosing information, because a lot of doctors are very intimidated by hormones.
They are.
And because they're very complicated. Like, you can get one hormone straight and the other one goes a whack, and it's literally like a teeter-totter. So you have to get them balanced to balance another one, and it just gets very complicated. And I'm here to help navigate that complicated situation. I have lots of training on it. I go to training twice a year. And so I'm more than happy to talk to anybody's physician to help them. I'm all about making women feel their best and be their best.
It really is. So. I mean, my life has changed meeting you. Is that too much?
Oh my God.
It has. It just feels like everything's clicking into place. I'm telling you, I'm like on fire after this conference, because I just feel like everything that I've ever done has led me to this point, and now we're just going to change so many lives. And also, people are so ready for this information. They don't want to be on pills. They don't want to be taking 10 pills, 20 pills. They want to treat themselves naturally. They want to get their bodies naturally working better. And this is what people want. Lily Johnston says, what advice would you give to someone recently diagnosed with PCOS? So Nima, I saw your question earlier. PCOS stands for polycystic ovarian syndrome. And it often presents with someone who has metabolic difficulties, difficulty losing weight, difficulty getting pregnant. A lot of them will get that cystic acne and hair around here. So when you see that, you can probably guess hormonal imbalance. And I'm definitely going to let you pick up on this question. The two things that I really, really got driven home at the conference for someone who is newly diagnosed with PCOS is number one, get a fasting insulin, a fasting hemoglobin A1C, and a fasting glucose so we can determine what your insulin resistance is, because you are very, very likely to be insulin resistant if you have PCOS. Number two, get on metformin immediately. Metformin is the only anti-aging drug there is, according to my BFF, Dr. Pamela. And another female physician that spoke, Dr. Bridget Briggs from Temecula, California, who is a family medicine and functional medicine practitioner and used to be an OBGYN. Wait, that was her, right? Yeah, I think. But anyway, Dr. Briggs basically said metformin is so poorly tolerated because it makes you shart on yourself and gives you stomach upset, because the formulation that people give now is not a good product. So either if you are diabetic, ask to have it compounded with Januvia, which is called Janumet, which you can get from a regular pharmacy, or get your compounding pharmacist bestie to compound it into a cream. You can take metformin as a cream, you guys. And so if you're supposed to be on 1,000 milligrams of metformin, then your dose for the cream is 100 milligrams. Because when you take 1,000 milligrams of metformin, all you're actually using is 100 milligrams of it, and the rest just makes you feel like crap. Apply it transdermally, get all the anti-aging and insulin-stabilizing effects of metformin, and never miss a beat. Boom, boom, boom. Bang, bang, bang. What about low-dose naltrexone? I did want you to kind of speak about the benefits of low-dose naltrexone, because that is another... All my poor patients today, they're calling me for weed, and I'm like, girl, tell me about your last cycle. I just wanted everyone to have a hormone test. They're like, I'm telling you that, I'm calling because I have glaucoma. I was like, I don't care about that. What about, you had a hysterectomy? Tell me about that. And there was a girl with Crohn's disease, which of course is an autoimmune disease. And I told her about low-dose naltrexone, and she had never heard of it as a treatment for autoimmune disease. So I would love for you to kind of share your knowledge on low-dose naltrexone.
Yes, so low-dose naltrexone, which is also called LDN, is an amazing compounding option for people with any sort of autoimmune disorder, lupus, Lyme's disease, rheumatoid arthritis, PCOS, any sort of autoimmune disorder where your body's immune system is out of whack. LDN is a phenomenal drug for that. If you get on Google and Google naltrexone or low-dose naltrexone, you might see the first thing that pops up is like opioid abuse. But that's at the 50 milligram dose. We're using it at micro doses, like 0.5 milligrams, 1 milligram, 2 milligram. You may also recognize a product called Contrave, which is used for weight loss. LDN is actually in Contrave at an 8 milligram dose, used to help like cravings, because it helps your brain when it's inflamed, or it can help with cravings of food, anything like that. So it's a great option for people instead of just throwing an opioid at someone. So people go to the rheumatoid doctor and they're just like, here's some hydrocodone, it'll make you feel better. But really the pain is from the inflammation. So LDN is just a phenomenal product. It comes in a capsule. We can also put it in a cream to put on scars. It helps with scars. It's amazing.
I think I want an LDN metformin cream. Just, can you make me that?
Sure.
I want to stay young forever.
I'll make you whatever you want, girl.
I know you will. Okay, let me get through some of these questions because I am going to let you go at 6:30. Thank you for hanging with us. Oh, this is the one that I didn't know a lot about, so I was going to ask you. Bridget asks, what about the Combi patch, COMBI? I apply a new patch twice a week, and I have not had a cycle in about 5 years. So I have to look that one up. I don't know that one. Do you know that one?
Yeah, what's like exactly her question?
I guess she's asking if it's good because I was talking about the
Yes.
different ways to take hormones. So I guess she's asking, let me know, Bridget, what you're asking specifically. I guess she's asking, is the Combi patch a good idea?
It's okay. It's got estradiol in it, but it also has a synthetic progesterone called norethindrone. Norethindrone is not the best, but also, if you're feeling good, I wouldn't mess with it, Like, don't break it if it's not, don't, what does that say?
Don't break it
fix
if it's not
ain't broke
fixing.
or whatever. I don't know, something like that.
As long as you're not taking an oral estrogen, you're good, I feel like. But if
That's
you ever
right,
do
yeah.
want to transition to what you're taking to completely bioidentical hormone replacement therapy, that is something that we can help you do. Can
Right.
you use naltrexone for fibromyalgia?
Yes!
Yes!
Yes! Yes! Yes.
Yes. Lord, yes.
You're getting naltrexone.
You're getting
naltrexone. You're getting naltrexone.
We're all getting it. And the thing is, like, the low-dose naltrexone is anti-inflammatory. And my CRP, which stands for C-reactive protein, which is a non-specific inflammatory marker. Anyway, all that to say, my body is always inflamed. Literally every time I test it, it's like my body's mad. So things like low-dose naltrexone, things like metformin, things like a high-quality fish oil, all the things that Kylie's Pharmacy provides, these are the things that decrease your inflammation. So literally, Julie said if it's not broke, don't try to fix it. Thank you, Julie. Couldn't do it without you. Love you. But I think the main thing, besides number 1, oral estrogen is bad, and number 2, saliva testing, not blood, and number 3, friends don't let friends put pellets in their butt, is number 4, make an appointment with your doctor or do the research on your own, but not too much because you might drive yourself crazy, and ask yourself, are the foods that I'm eating, are the supplements that I'm taking, are the medications that I'm prescribed pro-inflammatory, or are they anti-inflammatory? And just asking that one simple question will give you a lot of insight into things that you can change over time. Yes, you can rewatch this because I think my friend Virginia was going to watch it later, but I did also see she commented, so I think you're watching. Hi, Virginia. She also commented that extended release metformin is much easier on the stomach, and that is also true. That is also true.
Yes.
Okay. Boom, boom, boom. Oh, this is the one I wanted to ask. Would any of this help with ADHD as well? My daughter is 28, was diagnosed with PCOS at 15, and we have struggled to find solutions, and now she has been diagnosed with ADHD as an adult. Yes, I believe that balancing hormones and taking good nutraceuticals can change everything. Because if you don't, then you're inflamed. If you're inflamed, you're going to be diagnosed with things like anxiety, ADHD, depression, insomnia, hypercholesterolemia, when maybe it's just inflammation making you feel crazy and your body look bad on some labs. So yeah, I think pretty much everyone should have a hormone test. I literally sold out of my hormone test today because I told everybody that I've been so bossy since I got back from Vegas, Kylie. Like everyone that I talk to, I'm like, I don't care. I'm testing your hormones. Just hush. I'm testing them. LaShonda's like, what happened to you in Vegas? You're so bossy now.
You're not bossy. You're just a boss. Is that it? Or I'm just
Yes,
a boss?
I'm not bossy. I'm just the boss. Bam. Okay. You guys, you have 16 more precious minutes with Dr. Kylie Vadrine from Boudreaux's new drugstore in Lake Charles, Louisiana. So ask your questions. I feel like I got a lot of my excitement out of what I wanted to tell people. There's no way we can cover it all in one live, but it was just such mind-blowing information. Dementia. I feel like we can almost cure it. For real. If we just pay attention to insulin levels and hormone levels, I think the incidence of dementia could go down by like 95%. Dementia is type 3 diabetes, which is an inflammatory mediated disease. And it's also a pretty Western disease.
And And I was going to add, like, the take-home message is you want to get on estrogen early and not like too late, you know?
Yes, that was a big one.
So,
So not saying that, if you reached menopause at age 50 and you haven't been on anything for years, that it's not worth it. Please still get your hormones tested. Please still get replacement. But if you are a woman who has not reached menopause yet, or is just now suspecting that you might be reaching perimenopause, get on this, because the second half of your life, you can set up the next 60 years of your life to be amazing, and don't settle for anything less. That was a big take-home message, for sure.
That's right.
That's why I'm so excited. I attended this conference at 43. Hell yeah! I'm going to get pregnant, have another baby, get some menopause, get some estrogen. I just want to treat Oprah. Where's she at?
So funny. Where you at, Oprah?
Where you at, Oprah? Okay, let me see if I missed any.
We're trying to give you some LDN.
We're trying to give you some LDN, girl. Oh, yes. Tara says, do you mind dropping your contact info in the chat? Not at all. I'm going to give you my website, theweeddoctor.com. I'm going to give you my phone number, 318-777-WEED. And I'm going to give you my email address. And I believe LaShonda Bankhead was here, but just email. Can we make an appointment with Jaya to go over hormone therapy and weight loss? If you live in Caddo, Bossier, DeSoto parishes, not until Halloween 2025. But call me, because maybe I can offer other services. It's a non-compete thing. I got to honor it, blah, blah, blah. Which hormones do you recommend being tested? Raquel, I think you were the one that commented that you're a provider. I would order the saliva kits from ZRT Labs, and if you private message me, I can tell you how to do that, because the saliva test that they use tests progesterone, estrogen, cortisol, and testosterone. But they also have other kits, like you can specifically test for sleep balance hormones, or you can specifically test for metabolic hormones. But to me, that's the one you want, is the one with the 4. Does insurance cover any of the compounding meds? Ooh, you want to take that one on?
They do not. However, some insurances, I can give you a form and you can submit it and they can reimburse you. But we do accept like HSA cards and FSA cards. So if you work for a company that you put money onto that, we do accept that. It's just compounding is considered, like we have to make the medicine. It's not a pharmacological product. So that's why insurances won't cover it.
Insurance does not cover that saliva kit, but Raquel, I can help you. Just message me about that. And Kelly Sutter, if you're in Minden, you're in Webster Parish, girl. I can do everything for you. Medical marijuana, weight loss, hormones, wellness, prescription review, whatever you want. I am in Minden every Monday and Tuesday. I'd love for you to come see me in person. I am at the Beauty Bar
about
of
sexual
Minden.
health?
We didn't talk about sexual health. Okay, let's wrap it up with some sexual health.
Yes.
Somebody in the
Let's talk
room.
about sex, baby. Let's talk about you and me.
Let's talk about all the good things and the bad things that can be. Melissa Gosselin, I'm going to take care of you. Text me, girl. You got my cell phone. We are going to fix everyone's hormones. And also, estrogen makes your skin look good. Literally. Like it's responsible for this, the bounciness. Estrogen. Oh my God. Didn't even talk about the grandmas with the UTIs. So when you see people's, like a 60-year-old, 70-year-old, 80-year-old, and you see their skin, like you pinch it and it stays up, or your grandma starts to say, God, I'm just bruising all the time now. Estrogen. Literally, estrogen will fix that. When your grandma or your best friend is getting a UTI literally every month, I saw this patient all the time. Grandma comes in, she's confused. We find a UTI, we treat it with IV antibiotics. We completely decimate her healthy flora in her vaginal microbiome and her gut. She comes back in with a UTI, she gets more confused, she goes to rehab, she gets more confused, she falls and breaks a hip, now she has to have surgery. All of that is estrogen. If you can replace grandma's estrogen and thicken up her vaginal mucosa and strengthen her immune system again, she'll stop getting those UTIs. And I honestly wish I could go back in 12 years of medicine and tell every woman over the age of 50 that came in with a UTI, I wish I could be like, go get your hormones checked, girl, but I didn't know. And that's the thing. When you're stuck in the mainstream system, you don't know what you don't know. You're just trying to survive and see everyone.
Coming fast.
So that's why I'm glad. But yes, let's talk about sexual health. What you got
ma'am.
for the sex?
Let's do it. So we have a product called
What's it
we have a
called?
product called Screen Cream. It's called Screen Cream.
Tell us about the screen cream, girl.
So you apply it 3 times a week to increase the blood supply to your clitoral area. You also apply it 30 minutes before sex.
Yes.
And we can also flavor it for your man or your woman, whatever. We can
Yep,
flavor
it. That's very true.
You can flavor it. And we also have kind of like a gentleman's version. If your man has some ED issues, we can fix that. Pretty much anything we can fix. You got some vaginal dryness, we can fix that. You have some urinary incontinence leaking, we can fix that. We can just basically fix everything.
Y'all can,
Right?
I think
Right
on your
there.
website you call yourself the problem solvers, and you really are. And I don't even feel like I'm trying to pitch or sell anything. I'm just telling people the truth. You can take it or leave it. But everything that you're experiencing as you get older, whether it's urinary incontinence, vaginal dryness, difficulty getting or maintaining an erection, you don't have to, number one, you don't have to take a pill for it. And number two, you don't have to just live like that. Like, oh, I'm 60. This is what happens now. No, it's not. Your friendly neighborhood compounding pharmacist can
Nope.
help you. And she has medical grade supplements, pharmaceutical grade supplements. So if you're taking a fish oil, take the best fish oil. That's what I'm going to do. You know, if you're taking a multivitamin or magnesium, take the best one there is, because you're putting it inside your body. But the reason I started that whole tirade was to say, even while you're getting your hormones tested, Kylie can give you products that are still pharmaceutical grade to help you with vaginal dryness and erections and sexual satisfaction until we figured out what the root cause is, and then we can fix that. But there's Scream Cream for the
Yep.
women. There's Trimix injections for the men, which means you don't have to take a Viagra or Cialis orally. You can literally just use a localized medicine for an erection. And there's oxytocin nasal spray, which is the happy hormone that both the man or the woman or both partners can use for a very bonded, intimate experience. And what I thought was interesting in the last lecture by Renelle, but I just like saying Renelle's name like that. She's actually very nice. I just like saying, okay, Renelle. But what I thought was interesting in Renelle's lecture, who's also a pharmacist, is you can use oxytocin nasal spray for weight loss. She said there's a certain dosage that
Yep.
you do 4 times a day, and it helps with weight loss too. So very interesting. Did we answer all the questions? If y'all asked a question and we didn't answer it, let me know. But also, I'm going to come back and look at the comments to address. But if I can get her to agree, I'd like to do this every other week with Kylie. And
Yeah,
maybe
we
even
can do
have like
that.
our
That's
own
not a problem.
podcast and stuff. And we can call it Dr. J and Dr. K, 2 Hope Queens, which is a riff on those
Yeah.
comedians that have a podcast named 2 Dope Queens.
Mm.
Anybody
Ah?
feeling that? I feel like
Yeah.
the comments have stopped. What happened? Well, anything else that you want to
I
leave
think
them
we
with?
blew their mind, and
We blew their minds, and now they're all recovering. Let me say hi to Joan Harris, Virginia Parker, Kim Blunt. What's up, girl? Hope you have your read card. Your last name is Blunt. Michelle Chevalier, Destiny Jameson, Stephen Galbraith, one of my favorite nurse practitioners ever. Hi, Stephen. And Mary Taylor, Kelly Ford. Tiffany Hollis says it's all very interesting. I want it all. Girl, you can have it all. That's what I'm trying to tell you. I'm here to give it to you. You see me, Kylie makes what you need, you live your best life. Bazinga! Any
That's right.
contraindications to topical estrogen use? Who should not be taking topical estrogen?
are you asking me?
I don't know. Who shouldn't be taking a topical estrogen?
I mean, probably if you're having cancer treatments, like
Yeah.
you're currently, And definitely have anything that if you've had cancer at a young age, we're not talking about you have cancer at 60, because that could be from environmental factors because of your age. But if you got cancer young, definitely something you want to run past your oncologist before
sure.
starting. But they even have studies that show people that are breast cancer survivors still can be on estrogen. So
Correct. I saw a lot of comments where people were saying, I can't be on this anymore because of the breast cancer risk or because of the increased risk of stroke and heart attack or blood clots. Well, first of all, the 17 or 18-year follow-up to that Women's Health Initiative study was disproven. Turns out not so much.
yeah.
And second of all, if you're doing topical estrogen, you're definitely not increasing your risk of those things. You're probably decreasing it because it's what? Anti-inflammatory. Jennifer Johnson says, great information. Allison McClung says, can you explain what you said about Caddo and Bossier Parish residents? See, what had happened was I used to work at another place, and then I opened up my own place, and now secondary to agreements with the previous place, I can't practice certain kinds of medicine for Caddo, Bossier, and DeSoto residents. But I did get them to knock 17 days off, so Halloween 2025, I can start treating you guys. Otherwise, you can move to Minden or Texas. Or, I can still give you information, even if I can't be your doctor, right? Because information is power, and that's why we want to do these things. And I should say, most importantly, for any lawyers watching, that I am not your doctor just by you watching this Facebook Live. Kylie is not your pharmacist. We are discussing best practices for the information and the questions, but always go to your primary care provider before making any official medical decisions. Or come see me so I can be your doctor. Okay, I think we got it. This was I enjoyed it.
I can't believe I lasted this long. I thought an hour. Oh my gosh, it flew by.
There's a shadow behind the door. Who is it?
It's the Egyptian. Oh, hang on. Bye. Thank you. Yeah, no, I'm not leaving. Yeah.
I thought about locking them in.
No, don't lock him in. Bye. Okay.
Yeah, don't lock
That
people
was my
in.
other pharmacist.
If you have a Texas address, does that count? Yeah, girl. That's not Caddo, Bossier, DeSoto. What's up? Come see me.
Girl, you can't practice in Texas yet.
I'm this close. I'm driving to Marshall this Friday to get fingerprinted to get my Texas license. So, yes. Thank you, Tara. She says, I'm not sure how you came across my Facebook feed, but I'm glad the information will help, and now I can have a quality discussion with my OBGYN. Yes, ma'am. Knowledge is power. I want you to empower yourself with this information, and I want you to tell every woman and man that you know, because the more people that know that there's a better way out there, the sooner it will become mainstream medicine, because they will have no choice. So, spread it all around. Allison, I was born in Minden and grew up there. Can that count? If the license on file is Minden, Webster Parish, I can see ya. Call LaShonda. We'll make it happen, either now or Halloween of next year. Anyway, I do want to thank Dr. Kylie Vadrine for joining us tonight. Thank you, Kylie.
Thank you for having me.
Yes, you're the best.
I love talking about drugs.
I know. And then this is so great because you can work, but people get to know you, and then they fall in love with you, and they're like, I want her to be my pharmacist because I know and trust her because she's a regular human being and not a bot or a cog in a wheel. And everything that we learned was not sponsored by pharmaceutical industry, so that's why it made so much sense to me.
That's right.
All right, y'all. I'm going to drop the contact information for me and Dr. Kylie in the comments again. If you need me, you call at 318-777-6843. If you need Kylie, you can call or text 337
436-7216. And we do take text too, so you can text that number also.
Absolutely. Raquel, I know is a provider, so thank you so much for joining. The more providers we can get in our coalition, the better. Thank you, Stephanie, Yeah, thank you guys. Have a great night. And we'll see you again in 2 weeks if Kylie says yes.
Does she have blue hair?
Is she even a doctor?
Do you think she's high right now?
That's a secret I'll never tell. XOXO, the Wee Doctor.